Great, thank you very much. So we were trying to test a transdermal nitric oxide booster for the purposes of improving erectile function or improving blood flow to the penis. It was basically L-arginine in a proprietary delivery technology. There were 14 men, and we used a penile duplex ultrasound, but then we also imaged the penis with an ultrasound and sent those images out for what we call morphometrics, which is a microvascular analysis of the tissue. And so we tested patients on day 0, pre and post application of the serum. And then the patients took the serum home, applied it every night before they went to sleep. And then on day 30, we repeated analysis pre and post application of serum. And so unfortunately, the serum had some mixed results. So about 50% of the patients had improvement in vascularity, and 50% of the patients did not have any improvement in vascularity. And so the purpose of this presentation really isn't to talk to you about the serum, it's to talk to you about this new technology called morphometrics, or tissue segmentation technology. And so up here you can see the unsegmented crop frames. And so just to back up for a second, what we did is we used an ultrasound device and we imaged the entire penis. And then we sent those images out for analysis. And so what the software does is it looks at tissue segmentation, and that tissue segmentation is basically a proxy for vascularity. And then it overlays on the initial image. So almost like a PET CT scan. Okay. So what we're looking at here is one single slice through the penis, almost like a slice of cucumber. And so in patients in the study that improved, we could see that tissue segmentation improved from day 0 to day 28. And for patients who in the study did not improve, we could see really no change or no response on day 0 versus day 28. But the other really cool thing that you can do, as opposed to peak systolic velocity, which we checked in this study, but as we all know can be really highly subjective, somewhat random. You're basically checking one point in one part of a blood vessel in the penis. With the morphometrics technology, you can image the entire penis, almost like, almost like imaging the entire cucumber, and then the algorithm in the computer allows us to look at the tissue segmentation counts. So the penis is divided into 180 or 183 slices, and you look at the tissue segmentation in those slices. So this is a before day 0, and then this is a day 28 tissue segmentation. So you can see a significant increase in the number of counts in patients that improved, as opposed to a non-responder where the number of tissue segmentation doesn't change. The other really interesting thing that you can do that you can't really do with our current technology is look at volume and cross-sectional area. So this would be the cross-sectional area of the penis in a non-responder, so this would be before application of the serum. In a successful patient, this would be the volume post-application of the serum. And so even if we're looking at girth, you're typically looking at the girth or measurement of the girth in one single segment, whereas with the morphometrics technology, you can actually look at the girth of, or cross-sectional area of all of the segments for the entire length of the penis. So in this study that we did, only 50% of the patients showed improvement with the L-arginine serum. They showed those 50% of patients that were successful did show improvement in penile duplex ultrasound, but they also showed improvement with the morphometrics tissue segment counts and also an improvement in cross-sectional area. And the other interesting thing is the non-responders had a lower initial tissue segment count. And there was a good correlation between the duplex ultrasound and the morphometrics. So the morphometrics analysis of the penile ultrasound is potentially highly useful. So in the interest of time, I want to get to the potential uses of this technology. So first of all, it allows us to look at the vascularity of the flaccid penis, as opposed to using peak systolic velocity, in which case we have to use it in the rigid or the erect penis. In addition, it might be able to help us who would respond to regenerative treatment, right? So there's all this regenerative treatment out there, PRP and stem cells and shockwave therapy. This might be able to help us predict who's going to benefit from those type of treatments or who's too far gone. Also, it might help us predict the benefit whether someone has vasculogenic or psychogenic erectile dysfunction. So if someone has high tissue segmentation counts, then they're very unlikely to have psychogenic erectile dysfunction versus vasculogenic. So thank you very much.
Thank you very much. I think we've used up our time, so if you have questions for Dr. Brandeis, please do it after the session.
Great, thanks.
Next presentation will be from